Welcome to Real World NP's Clinical Pearls, where we take gems from full-length episodes and break them into quick, digestible insights. I'm Liz Rohr, family nurse practitioner, and my pronouns are they, she. Real World NP is a continuing education company for nurse practitioners in primary care, especially new nurse practitioners navigating the role transition from RN to NP. Whether you're on your commute between patients or prepping for an exam, these bite-sized takeaways can help you build confidence in your practice. Let's dive in.
So if somebody documented a 4, you can go through and literally check the boxes off of this whole cheat sheet for each note that we're talking about or that you're looking at, and you can kind of see, did they meet the criteria, right? Just for fun. Again, it takes a little bit of time, but even if you just did 3 notes, you would feel, I think, a lot better about it. So again, step 1 is looking at your level of risk. And so this table here is not part of the guidelines, but it was made after to help guide clinicians. And I saw it cited from a variety of sources in different ways, and I kind of put it together in this way that was helpful. I had a resource in the past that had this already made out, and I can't seem to find it, but this is based on putting all the data together into this table. So anyway, this is the guidance that is developed after the guidelines came out. So what you're looking at, and actually going back to the presentation, the 3 things here are risk, problem points, and then data points. I'm sorry, it's not letting me do that. So what we're looking at here is your risk, the level of risk of the problem, the data points involved, and then the problem points. And so underneath here are the problem points and the data reviewed points. So let's just start with the table of risk. So this is literally out of the guidelines. This is the table of risk from the CMS guidelines. And it typically matches up this way. It's not written on here, but you could print this out, and then I have this printed out at my desk, but you could print it out and write next to it. Typically, level of risk minimal is a level 2. Low risk is a level 3. Moderate is a level 4. And then high risk is a level 5. And what's on this table is you're looking at the different problem examples. The middle column is diagnostic procedures ordered, and then management options selected. And you don't necessarily have to have 1, 2, and 3 for them to qualify for minimal, but if it's kind of helping inform you make your decision. So what testing are you doing for this problem? What interventions are you doing for this problem? So if your intervention for your problem is gargles and rest, likely it's a minimal risk problem, right? If it doesn't say it here, insect bite, tinea corporis, things like that. So tinea is interesting because you can prescribe for it, but I believe it's because it's over the counter, like clotrimazole is, the treatment. That's why it's considered like a minimal risk one. But anyway, like I said, you don't have to have all of these, but you're looking at the reason to print out this table is that you can look at the examples here of the different presenting problems to help guide you in that medical decision making. So if we kind of toggle back here to this cheat sheet, again, you're literally going to fill this out. So what is your level of risk for your problem? Is it minimal, low, or moderate? Again, because the high risk ones are typically you're sending them to the ER. Because if we scroll down to the high risk ones, they're having elective major surgeries, emergency major surgeries, things like that, which you're not doing in primary care, but you can kind of select here. So I'm going to slow down for a second. So again, level 2, self-limited or minor problems like a cold, upper respiratory infection, that's just supportive care, insect bite, things like that. A level 3, a low risk, is 2 or more self-limited or minor problems. So if you had a couple of those, or if you had 1 stable chronic illness, well-controlled hypertension, not insulin-controlled diabetes, patients who have BPH, or 1 acute illness like a cystitis or allergic rhinitis, things like that. Actually, I thought that was under minimal, but I guess that's considered a low risk one. So you couldn't bill for a 3 if you had allergic rhinitis. Moderate, those are 1 or more chronic illnesses with a mild exacerbation. 2 or more stable chronic illnesses like diabetes and hypertension, things like that, or an undiagnosed new problem with an uncertain prognosis. And again, like I said, the vast majority of the time, moderate is going to be a level 4, but it depends on this further calculation. So let's just go back for a second. So you're looking at the end of your note, you're looking at the billing code, you're looking at the level of risk, which you're going to look at that table of risk from the CMS guidelines, and then you're going to scroll down to these tables and then add them up. And the important point here is that you need 2 out of 3 of these. You don't necessarily need all 3 of those to qualify, but let's just go down. So problem points, what are the points that are associated with that? Again, these are not in the guidelines, but this is guidance that was developed after the guidelines. And so, for example, if you have somebody with a cystitis, You have an option of a self-limited or minor problem, established problem that's stable or improving, an established problem that's worsening, or a new problem, but you don't have any other workup planned, or a new problem with additional workup planned, right? That kind of makes sense in terms of your clinical decision making, right? So for an example, if you have somebody with cystitis, you have a new problem, but no further workup is planned. Like you just did, maybe you did a urinalysis, right? But you're not necessarily going to send out a culture because you can treat them empirically. And so what you're going to do is go back to their table of risk. I know from looking at this 1,000 times that cystitis is qualified under the low risk level, and that's a level 3. She doesn't have systemic symptoms, for example, if we're talking about a woman who comes in with dysuria. So we're in a low risk, and we're looking at the problem points. So it's a new problem with no additional workup, so it's a level 3. So it could technically fall into a level 4, but your risk needs to be moderate. So it has enough points to qualify for a level 3, but not enough to qualify for a level 4, if that makes sense. And then your data reviewed points, we actually don't need to do this for that particular example because, again, it's only 2 out of 3. But you could look at the data reviewed points. So did you order any lab tests? I guess if you sent, urinalysis would count. X-ray, EKG, did you discuss the tests with a performing physician? If you were talking about a specialist, ordered some labs and then you get on the phone and talk to them. Or if you independently reviewed an X-ray or an EKG tracing, if you went through old records, things like that, review and summation, you get like different data points involved there. And you can have multiples, right? Which will kind of add you up to that 3 if you're looking at a level 4 type of visit. So again, step 1, you're looking at medical decision making. You're literally going to these points, looking at this table of risk and filling it out. And do they qualify or not? And so let's go back to the presentation here. So again, those 3 things: risk, number of problem points, and then the data points, and then your documentation. And I'm gonna try not to bore you to death because I clearly am excited about this, but you just want the nuts and bolts so you can do it right. So I'm gonna try and be as brief as possible. But basically, these are the elements that your note needs to have. And the amount that you document is what differentiates levels 2 through 5 or 1 through 5. But again, we're not really doing level 1s. Everyone needs a chief complaint, regardless of level. Number 2, everyone needs an HPI. However, the difference is how much you document. Number 3, past medical history or surgical history, family history, and social history has a star next to it because actually only the ones that need that are new visits are a little bit different, but established visits for a 4 and above are the only ones that actually require that to qualify. ROS, I have that everybody should have that. I mean, typically if you're doing a note, you're going to include some kind of ROS, right? But technically, if you have a level 2 problem, you actually don't need to document anything under the ROS.
Enjoyed this clinical pearl? There's even more valuable insight in the full episode. Click the link in the description to hear the complete discussion, packed with practical tips to strengthen your skills and confidence as a nurse practitioner. Don't miss it. And if you found this helpful, be sure to like, subscribe, and share with your fellow NPs so we can keep learning together.